Welcome, everybody, to the digital launch of the Lancet's One Health Commission. It's great to be with you. My name is Richard Horton, editor of the Lancet, and we have a simply fabulous, absolutely fantastic program for you today with ample opportunities for your engagement. So get ready. You're going to learn about what the Commission says from our two expert co-chairs, Professors Andrea Winkler and John Amuasi. Then you're going to hear from individual commissioners about different aspects of the Commission's work, moderated by Andrea, John, and my colleague, Dr. Pamela Das. And I'd like to thank at this point, Andrea, John, all the commissioners, Pam and my colleagues at the Lancet for their tremendous work on this project. And please also a big shout out to our friends in Kumasi in Ghana for their brilliant commitment to hosting this webinar. A few housekeeping notes to begin. We are recording you, so be careful what you say, because we've had over 1,000 people registering for this webinar, and I'm sure you can't all watch it all at the same time. So, but you will be able to watch it afterwards. It will be posted on the Commission's website. Please also use the chat and the Q&A facilities. We want to have a robust discussion, and John's team in Kumasi will be gathering your questions and thoughts to put to our various panels. But before we begin, I just want us to consider for a moment where we are with global health today. Earlier this week, we published work that tracked development assistance for health between 1990 and this year, 2025, and then looked out to 2030. And to cut a very long and pretty painful and dispiriting story short, development assistance for health, although it peaked at just over $80 billion in 2021, is projected to fall, actually collapse, to less than half of that sum, $38.4 billion this year in 2025. And over the next 5 years, it's projected to continue its decline to just over $36 billion by 2030. So the reality is, as we have this conversation today, the landscape of global health is undergoing a transformation of absolutely seismic proportions. The vision for sustainable development, at least as represented by the Sustainable Development Goals, is shattered. The idea that we've had for delivering real improvements in health equity has been torn apart. And all of the assumptions that have governed global health for 25 years, strong and important and growing partnerships and commitments to advance health, and above all, achieve the goal of universal health coverage, all of those assumptions are now being erased. I really don't think that the global health community has fully appreciated the scale of this dramatic adjustment that is unfolding. We are receiving papers and proposals at the Lancet that are purporting to map out that future, but which reassert old premises, old assumptions, old presumptions that take almost no account at all of the present catastrophic circumstances. So, as we meet today, we need new thinking, we need new strategies, and we need new methods for dealing with the triple planetary crisis that we face of climate change, biodiversity loss, and pollution. And this One Health Commission, what you're going to spend the next couple of hours participating in now, begins that process of reconceptualizing global health by setting out a radically fresh outlook for One Health. I can tell you honestly that when I first read the draft of this commission, I was extremely excited by its arguments, by its ideas, and by its vision. And I believe you will be excited by it too. So let me stop and let me hand over immediately to our two stars, Andrea and John, to tell you more about their simply fantastic work.
Well, thank you, Richard, so much for your kind introduction and also for the bold statement. And of course, you're very right, change is needed. We would also like to actually open our panel here or our deliberations with a bold statement. So our bold statement, Richard and colleagues, is that we feel strongly that the socio-ecological system is the answer to the transformation that we need for the 21st century. We need equity in our socio-ecological system. And John will explicate what the socio-ecological system is to you in a moment. We also need inter and transdisciplinarity. We need cross-sectorality to actually advance human, animal, plant health and the health of the environment at large, which includes soil, water, and air, and also other biotic and abiotic elements. We truly and utterly think that this is possible through concerted efforts and joint agenda setting. So I just really move on to the outline of our report. Just to give you a quick sneak peek, the report now is online. It has been online since tonight, so you can read it, but I guess that most of you have not read it yet. So after the background, we actually go on to explicate what we mean with the socio-ecological system that we propose is the foundation of One Health. And then after that, we use a One Health lens for surveillance beyond disease detection, for infectious diseases, but also non-communicable diseases, for antimicrobial resistance, for One Health systems. And we then also, towards the end, have a large use case on food systems and One Health. Towards the end of the report, we will have avenues, or there are avenues that propose ways of how One Health can be operationalized, implemented and institutionalized throughout governance, economics, and the knowledge systems. And at the very end, we arrive at our 10 recommendations that are short actually in the report, but have been detailed in the appendix for a better world. The report synthesizes the current state of knowledge on One Health, and this is really new. So we have performed evidence synthesis and informed dialogues with experts, our commissioners and advisors throughout years to arrive at the messages and recommendations of our report. It also offers a systems-based understanding of health interdependencies. So the systems approach is enormously important. And we suggest a roadmap, as I just explained, through the lens of governance, economics and finance, and knowledge systems towards the end, how One Health can be implemented. In this, now we come to our roadmap. This is actually my favorite slide, and you may be surprised, but One Health really is an old concept. It most likely as old as humanity itself, as the interconnectedness and interdependencies of humans, animals, and their shared environment is intrinsic knowledge to many indigenous cultures. Also in biomedicine, from ancient Greeks like Hippocrates to Rudolf Virchow in the late 19th century, the connection between human and animal health was already addressed. One Health as a term was coined by the authors of the Manhattan Principles in 2004, which later became the Berlin Principles. And around 2010, first One Health structures were established, like the One Health Commission, not our Lancet One Health Commission, but a platform for cross-sectoral collaboration. and also the Tripartite Alliance on One Health by the WHO, FAO, and WA, which is the World Organization for Animal Health, has been established. Structures that are really enormously important for implementing One Health. However, those structures have further developed. In 2019, when our commission was launched, the commission, not the report, we had an inaugural meeting held in Oslo. We were actually ready to go. We had a framework, and then you all know, then in early 2020 or late 2019, COVID-19 hit the world, and we were thrown off track. However, there were also opportunities. Suddenly, One Health was everywhere. It was in many narratives and discourses, but it was an evolving concept. It was no longer this strict and tight concept at the intersection of human and animal health. It actually evolved, and that was our chance. And this also determined our trajectories. We were a bit paralyzed, first of all, but we quickly reorientated ourselves and then started really deep work between 2021 and 2023. We built on structures like the One Health high-level expert panel and also the One Health quadripartite that had been established in 2021 and 2022, and remained in really close dialogue and contact with them throughout the drafting of our report. Another milestone was actually the publication of the Lancet series of One Health and Global Health Security in 2023. And then after our in-depth work and our submission of the report, we did more work. We also prepared the launch. We had pre-launch events in May at the World Health Assembly already through the One Sustainable Health Forum. And in June, we had pre-launch events at the universities of Oxford and Nairobi. Another really important milestone that John will explicate later on is indeed the pandemic agreement that was negotiated throughout the birth of our commission, and where One Health really plays a crucial role. I could go on and on and on, but you can see that One Health is not new, that our commission is placed in an ecosystem that many clever people have done a lot of thought-provoking work before us, that we have grabbed that and through the new developments have given One Health a new face that is fit to manage the challenges of the 21st century. I shall stop here. Today's our day, please, and I will hand over to my dear co-chair, John Amuasi.
Well, thank you very much for that, Andrea. Wonderful introduction. But I believe we're already off to a great start, and I wish to present to you our illustration that brings to life the work of the commission. And you would see what we want to look at it as a globe that we have kind of cross section through, and it presents our view of how One Health should be. Now, what we like to say is that the key thing here is having an ethos, having something that we all believe in, something that transcends different cultures and genders and different peoples, a shared basis. And this is what we refer to as the ethos, the holism and systems thinking, epistemological pluralism, equity and egalitarianism, and then stewardship and sustainability. So you'd realize that we have this encapsulating the globe, really reflecting this as what covers us all. And within that, we speak to the drivers, or shall I actually say the drivers, the avenues via which we will drive One Health. And later in the presentation, I will come to these avenues, and they are governance, knowledge, and economics. I'll have some time to share a little bit more with you on those. So in this diagram, much like the OLEP illustration of One Health, we move away from the traditional Venn diagram, which shows the intersecting circles of human, animal, and environmental health, and really show that you really have One Health all throughout, and it's really about understanding what makes this happen and harnessing this knowledge and understanding to promote what is really at the core and what we desire, the healthy, sustainable, socio-ecological systems. So what we do here is show key issues like food systems, surveillance and intervention, and then the shared environment. And then we also extricate key issues within each of these, including infectious diseases, antimicrobial resistance, and non-communicable diseases. And you will hear later during the panel discussions, especially how we look at non-communicable diseases and the role that they have to play in One Health, and the interconnection between non-communicable diseases and infectious diseases, and what this really means for One Health. The publication is out, and you can drink it all in, this globe, and what we think of the way One Health should be looked at. Now, in this diagram, and I'm pleased to say the Lancet will be working with us on animating this, and we are looking at it as something that could be used as a very powerful teaching tool at various levels of education. And if you remember from the previous illustration, I did mention that we are looking at education and knowledge systems as one of the avenues for pursuing a One Health agenda. And what this means is we need to have the tools to be able to teach children, even at the lowest levels of education, what One Health is about, so that we develop a literate society and sharing a common ethos. And therefore, when we need to negotiate, when we need to discuss trade-offs, when we need to think about doing things in a different way, we would all be on the same page. And this illustration really brings to the fore the healthy, sustainable socio-ecological systems we desire, because it also shows some of the unhealthy socio-ecological systems that we have invariably created. We invoke the ways in which living in this world impact on climate change, on biodiversity and pollution, and show how these are all complexly interlinked. Current evidence is showing how even the presence of microplastics and others in the environment has a profound impact on risk for non-communicable diseases, but also increased risk for infectious diseases, especially pollution in the seas and implications for marine life. Not to speak of also the prospects that the seas have for us by way of providing food and alternative sources of livelihood and living. So this diagram, one could spend, I guess, an entire semester perhaps lecturing just on this diagram, and we invite you to engage with this diagram in the publication, and use it as you would for your teaching and for your discourse.
Thank you very much, John. In our commission, we have arrived at key messages. It's just far too short, of course, to show you everything in half an hour. And these are not all key messages. It's just a selection. So message number one is that One Health is collaborative, it is interdisciplinary, and it is multi-sectoral. We are addressing global health, but through global health, also sustainability challenges. It's rooted in the understanding that the health of humans, animals, and plants are deeply interconnected. I think we were able to make this point now. As John has just introduced the socio-ecological system, that interconnection within that system, and it can be built and unbuilt, is central to our One Health thinking. And in that system, we have climate change, biodiversity loss, pollution. And the important thing is that it doesn't impact all the different elements in that system at the same time and equally. This is why we need equity, and we need an equitable One Health approach. One Health considers these risks and calls for an urgent action through climate mitigation, conservation, and ecological restoration. Number 3, One Health expands the scope of surveillance beyond disease detection. We want to prevent, and we want to include, or we call for an inclusion of the determinants of health: social, economic, political, environmental. This approach supports resilient ecosystems and promotes environments that sustain health of all living creatures, not just their health, but also their well-being. Number 4, One Health is vital for transforming food systems. And I already told you that we have a huge use case, One Health use case in our report on food systems. Please do read it. It helps address complex challenges like food safety, security, equity, while also promoting the health of people, animals, and plants, but also calling out actors that need to come to the table. And I guess that Alafia will speak to that. Number 5, guided by principles, as John has just explicated, of holism, equity, sustainability, short the One Health ethos. One Health provides a comprehensive framework for tackling not just infectious diseases, but also non-communicable diseases, antimicrobial resistance, and other systemic threats. It promotes integrated, fair, and context-sensitive responses across all levels in the most equitable way. Number 6, One Health plays an important role in shaping global health and sustainability futures and agendas. It calls for systemic changes in governance, economic models, and knowledge systems. It rocks the boat. Prioritizing equity, inclusion, and collaboration to achieve lasting socio-ecological health for all.
Thank you very much for that, Andrea. And with that, we come to the avenues for One Health operationalization, implementation, and institutionalization. The argument is, with all this information that we have, how do we do what should be the approach towards pursuing One Health? And in our report, and where we showed these 3 avenues for operationalizing, implementing, and institutionalizing One Health. I'd like to dive into each of these, bearing in mind that in operationalization, what we want to do is to make sure that we have been able to turn One Health concepts into actionable strategies after we've been able to have them embedded as a standard, as a go-to. And it's exciting, thanks to the work done by the OLEP, that we now have a common globally accepted definition for One Health, which the Commission fully endorses and makes full use of. And also that we have One Health having been invoked in the pandemic treaty as the main vehicle via which it will be implemented. And then for the implementation of One Health, we want to make sure that those strategies are being put into effect across various sectors. So I'll start with the One Health governance, and this is a very complex issue. And we're looking at One Health governance as trying to achieve something akin to health in all policies, where there are shared standards and shared responsibilities and accountability across all sectors. We have made some progress towards this globally. Certainly, we wouldn't have come this far without the quadripartite and the work of the OLEP. It's really, shall I say, been a springboard to advancing One Health significantly. We have over 100 countries with national action plans for AMR, and so this already demonstrates that there is some significant progress within the sphere of being able to advance One Health. But we have serious challenges, including fragmentation issues, including gaps in the legal framework, which needs to be addressed. We still have a relative neglect of NCDs in the One Health discourse, and one of the things that our report seeks to do is to accentuate NCDs and to show the critical role that they play in One Health, and then the interaction also between NCDs and infectious diseases. And then we also show how funding limitations have a significant role to play, and the power imbalances that come with that. We're all privy to the changing global health landscape as a result of funding challenges that various key stakeholders within the global health sphere are facing. Not to speak of the perennial sectoral silos, which have belabored or really bogged down One Health and what we call elite capture. So these are some of the One Health governance issues that we extricate in our report. And then we come to the issue of One Health economics and funding. And with this, we really make it clear that the current global, shall I say, financing mechanism or global system of defining progress and defining wealth is fundamentally antithetical to One Health. The GDP growth paradigm, if you really dissect it carefully, you would conclude that it just does not support a One Health approach. Now, that's what we have now. That's the way the world is run. What can we do to make things different? What we need to do is to demonstrate the added value of One Health. And one of our commissioners, Jakob Zinstag, is really an expert in this area amongst several other commissioners. But really demonstrating that even with the current paradigm, we can develop a system of showing the added value of One Health. But ultimately, we need to move to a different way of looking at things, a different way of valuing progress and development if we really want to pursue these healthy, sustainable, socio-ecological systems. And it means that One Health will need to be embedded across all policies. It means that we'd have to have frank discussions on competing priorities and what the unintended harms would be, and several other sacrifices, if I put it that way, will need to be made based on clear agreements and different ways of thinking. And with that, I come to the third avenue for pursuing One Health, and that is One Health knowledge. I have already alluded to this when I made mention of the need for One Health to be taught and discussed at all levels, including at the primary school levels. It would be critical for curriculum to be developed, a curriculum that is sensitive to different genders, different cultures, different parts of the world, but also unifying in a way so that there is a clear understanding right from the junior most years of the fundamental interconnectedness of peoples and other animals in the world in which we live. The teaching of the One Health approach across different disciplines at different educational levels is also very critical. That way, the expectation is that we would develop professionals who have One Health competencies, not only at the tertiary levels of education, but across all levels of education. One Health becomes the new normal, so to speak. And of course, being able to engage with the public and communicate. We've seen the challenges globally in communicating science and explaining the complexity and the changes that take place, sometimes naturally and unnaturally, and also explaining the changes that we need to make based on our better understanding of science, and explaining and showing how it is not necessarily flip-flopping on a message, but just following the science and understanding what is happening and tweaking and adjusting based on the knowledge that we have. And this requires constant public engagement and real understanding of how communication works. And ultimately, the leadership is critical. We've seen this through the quadripartite, seen this through the work that OLEP has produced, but still really important leadership and policy integration is needed across the board. Back to you, Andrea.
Thank you, John. At the end now of our submission, we just go quickly through the 10 recommendations. You will see a slide and just the title. However, in our appendix, please, we have detailed for each recommendation the what, the how, the who, and when. And we have called out institutions, platforms, actors, decision makers explicitly, and we have suggested very strict timelines and milestones. The first recommendation, as you see here, is to institutionalize One Health within global, regional, and national governance architectures at the global, the regional, the national, and the local level. And we are suggesting a One Health framework or a One Health structure that will implement recommendation 1. Recommendation 2 is to achieve coherent One Health policy and governance through One Health in all policies, similar to Health in all policies. And a big shout out to Ilona Kickbush for having paved the way. Recommendation 3, we suggest to integrate human, animal, and environmental health and surveillance systems throughout the health system building blocks suggested by WHO. We encourage achievement of transformation of global economics that prioritize equity, sustainability, and well-being as the key measure of progress. Recommendation 5 is about operationalization, implementation, and institutionalization of adequate, innovative, transparent, and equitable financing for One Health. Over to you, John.
Thank you very much, Andrea. And with recommendation 6, what we do is to recommend that we need to harness the full potential of the private sector. And in this, we point out that we cannot do without the private sector. Many aspects of our lives are so intertwined with the private sector, especially if you think of the role that artificial intelligence and other what are now becoming backbones of our lives and the roles they play. And the majority of this power and this capacity really exists in the private sector. If you think about food systems and others, which I believe Carlos and colleagues will be discussing shortly. The other recommendation is what I already spoke to about making One Health normal. We don't want One Health to be seen as some highfalutin concept which is discussed at tertiary levels and at boardrooms, but something that is just a way of thinking, a way of life. It cuts across all educational sectors and really drives and sustains systemic transformations. And in our 8th recommendation, we recommend that we cultivate enabling conditions for One Health research and knowledge production. It means fundamentally changing the way in which we do research and the considerations that we make when doing research. Considerations of climate, considerations of implications, just understanding the complex interactions and the knock-on effects of the research that we do and the impact that it will have and the inherent complexities that we face. And with the 9th recommendation, we ultimately, these are to achieve a One Health literate global citizenry. So this is very similar in many ways to the eighth recommendation, and we clearly indicate that this is so critical across the board. And our final recommendation is we would like to achieve a One Health oriented transformation of food systems in service to equity, sustainability, and to health. And in our report, these are detailed exhaustively. And once again, I invite you to engage with the report at this level. I will just conclude as we move towards the end of this presentation and enter into the panel discussions, which I'm really looking forward to myself. We would recognize that barely a month ago, or shall I say almost 2 months ago, the WHO pandemic agreement was achieved. I mean, this was a landmark event in global health, and we've all been excited by it, particularly because in the WHO pandemic agreement, One Health is mentioned categorically as the driver of this agreement. Come to think of it, One Health was never mentioned in the Sustainable Development Goals, and not even mentioned as a driver of the Sustainable Development Goals. But lo and behold, One Health is now the engine of only the second ever legally binding instrument put forward at the World Health Assembly level. And this is exciting. So what we try to do is to show what contributions our report can make in driving forward the WHO pandemic agreement, especially as the annexes are yet to be put forward, and also the agreement is yet to be signed onto by most member states. I cannot go through this entire slide because we are behind time and we wouldn't want to keep you too long. So I'll quickly touch on just a few aspects. We believe that the report provides important support for innovation and future preparedness. It aligns very strongly with the pandemic agreement's goals for a resilient and future-ready system. We do provide in the annexes of the report, and I encourage you to engage with this, a detailed breakdown of the who, the what, the where, and the when regarding what should be done next in One Health. And we think that the Lancet One Health Commission report can provide a very practical tool to the WHO pandemic agreement and its implementation, including informing, supporting, guiding the development of concrete metrics for following One Health progress and accountability. I'll touch on one more. We also believe that it strongly supports the development of a conceptual and ethical framework. You see this throughout the work of OLEP. You see this also in the WHO pandemic agreement, this need for an ethical foundation, this need for ethos when it comes to One Health. And we believe that the more we sound the bells of the need for us to really orient ourselves to thinking about our fundamental interconnectedness as humans and then other animals and the shared environment, it really forms the strongest impermeable foundation to be able to pursue a One Health approach to achieve the healthy, sustainable socio-ecological systems that we desire.
Thank you, John, for putting the pandemic agreement center stage. And we feel that our commission contributes very timely to that tremendous piece of work. Now, it only remains, before we start with the panel discussions, to say the thank you words. And first of all, I think, I guess, John, we have to thank each other for having pulled through and still be talking to one another. No, I mean, I'm joking. I think a most beautiful friendship has actually emerged through our 7 years of collaboration. And I wholeheartedly thank you for this, John. A happy thank you goes to all our commissioners and advisors for their wisdom and also willingness to share, willingness to listen to one another, and for their patience with us, the co-chairs. They come from across the world. They have been chosen in a very equitable way. A sad thank you, unfortunately, goes to Ricardo Thompson, whose contribution to One Health has been invaluable and who would have deeply enriched our team, but unfortunately passed away all too soon. He was a commissioner and died very early in the process. A heartfelt thank you to our young scientific and graphical support collaborators who have enriched the Commission's work tremendously. And a very big thank you to the 3 secretariats, the University of Oslo, the Kwame Nkrumah University of Science and Technology, and the Technical University of Munich secretariats. I cannot close without having thanked 2 people. Please go back. I cannot close without having thanked 2 people who have been with us from the beginning to the end and beyond, and without whom the Commission would not have been possible. This is Ingeborg Hovertsen and Christina Brooks, not only for their magic and highly socially skilled management skills, but in addition, Christina, for having shaped the Commission with her fine social science chisel. Christina, it's been a pleasure. And finally, a loud shout out to our funders, the then German Federal Ministry of Education and Research, which has now been renamed, and the UIO Life Science from the University of Oslo. Without your support, that commission definitely would not have been possible. And very last, but definitely not least, a heartfelt thank you also to the whole Lancet team, our 2 editors, Tamara Lucas and Pam Das, who we had the pleasure to work with, and of course to Richard Horton.